Greetings, Integra Therapy family. How are you? Hope that you're well, wherever you are, that you're finding some really meaningful connections with your body, with your mind, with your environment, the people around you, in very resourceful ways. If you're joining me for the first time, my name is Andrea Wright. I'm from Integra Therapy. Thank you for watching. Today, I've got a really juicy one for you. Juicy because this is going to be absolutely brilliant. For those of you who use computers a lot, those of you who do manual work, using your hands with repetitive movements, this is excellent. For those of you who may experience pain in your forearms, they generally are on the outside of your forearm, otherwise known as upper limb work related disorders. But in simple terms, you may have pain from your elbow, otherwise known as tennis elbow, anywhere from the elbow down through into the hand. This video is really going to be key for you working into those problem regions. What's great about this video is that, and you won't see in other videos, is that the level of detail and the exploration is what's going to make this most effective. So let's get started. Find a chair, have your feet planted on the ground firmly. Make sure that you're sitting comfortably in the chair. Always do a little warm up, moving your shoulders, breathing gently, moving in one direction, moving in another direction. You'll notice in all of these videos, you'll see me do this. You might skip this, but I encourage you to join in because it's a way in which you can connect with your body a little bit more readily. Inhale as you shrug your shoulders, exhale as you release, and then finding your sit bones, working to move them and allow the shaking and the wiggle to take over your shoulders. Keep breathing. Inhale and relax. How did you find it? So we're going to begin. So I am going to use my left hand or my right hand to demonstrate. What you need to do is to make a fist. You're going to extend your arm in front of you and you're going to keep your elbow straight. I'm going to turn to the side to better illustrate. So be careful not to shrug your shoulders, okay? It can be a little bit tricky at first, but see if you can try and keep these parameters as I'm describing them. Keep your elbows straight, making a fist. What's important here is that you fully, particularly your index finger, roll it around, okay? That's important. It's not a tight fist, but it's a closed fist. You're going to take your other hand, perhaps with your index finger or your index and middle finger, on the back, making sure that you include the back of the index finger here. And you're going to support the wrist and fingers curling towards your armpit. I'll do that again. You're curling towards your armpit. What's really important here is that you keep the connection to the back of your index finger. That's because it has two tendons largely governing its movement and it has a greater level of force generated through it. So what will tend to happen is that you may find that as you begin to curl the fingers around, you'll feel a stretching in your forearm. Your index finger will tend to pop out or want to pop out. It's important that you keep that wrapped in, yeah? You may want to use your thumb to help you. You may want to use your thumb to help you. This is your first position. We're going to intersect or then think about the cardinal points in terms of positioning. So let's call this 6 o'clock or south. You curl until you feel a stretch in anywhere along the forearm. You may even feel it at any point in the back of the shoulder. Depending on where you are, you might not curl as far as me. You go to where you feel that comfortable pull. And you breathe here, in and out. I always use the magic number 5. Then, this is where it gets interesting. Keeping these parameters where you can, you're going to rotate the wrist to another one of those cardinal points. You might call it west or east. In my position here, this is west. You may call it 9 o'clock. Notice the feeling or the pull may change. It can be at the back of the wrist, anywhere along this complex, the extensors of the forearm. You may want to change your hand hold so that you have a little bit more purchase on the wrist. Remember, you are curling the fingers towards the armpit. Again, breathe for 5 times. Trying to keep the elbows straight, the shoulders down. Let's move to north. North is often tricky, so bend the elbow, reposition, keeping the wrist, straighten the elbow, and then curl. This is commonly more difficult. You may need to change the hands to keep the pressure on the back of the index finger and just watch that index finger doesn't pop out. You may not get a lot of movement here as you start. It may be just tricky to bend it and to keep the shoulder down and to stop the elbow breaking. Just take your time. Straighten the elbow. Use the hand to pull towards the armpit. Towards the armpit. Then you're going to change. Your shoulder may be a little bit stiff if you're holding it there for too long. Just take a rest. Then start again, make a fist, bend. So now this one's interesting. You're going to go to the other cardinal point. In my case, this is east. You may need to come underneath now. Some people prefer on top. I'm going to go underneath. Back of the index finger, using your other hand to curl around. No, it's very tricky, but take your time. You may not get all the way there, you may be here. But do your best, you're rotating the arm and bringing the fingers towards the armpit, taking 5 breaths. And in each of those places, you will probably feel pulling in different areas, and that's exactly normal and common. What you want to do is do that maybe 3 times a day. Each of those cardinal points or positions, remembering to keep your index finger in and your elbow straight and your shoulder down. That's it for now. Leave a comment. If you're liking this material, please, I invite you to subscribe. Take care. See you again. And be well. Bye for now.